Number 8. Tobacco smoke enemas. In the late 1700s, Britain and parts of Europe treated warmed tobacco smoke as an emergency remedy, and in London, the Royal Humane Society, founded in 1774 by William Hawes and Thomas Cogan as the Society for the Recovery of Persons Apparently Drowned, kept rescue stations along the Thames stocked with the gear. The idea was simple and alarming. Blow tobacco smoke into the rectum through a tube, bellows, or a fumigator kit, and nicotine would jolt breathing and circulation back to life. Doctors also pushed tobacco clisters for bowel obstruction and so-called suspended animation, which tells you how wide the claim spread. The method peaked in the 1700s and early 1800s, then started to fail under real scrutiny. In 1811, Benjamin Brodie showed that nicotine could stop the heart in animal experiments, and the supposed rescue turned into a warning label. That left medicine to move on, and the next cure aimed straight at something far more ordinary, which made the damage easier to sell. Number 7. Cocaine toothache drops and tonics. In the late 19th century, this was a legal pharmacy shortcut in Europe and the United States, a nerve-numbing chemical sold for pain you could point to with one finger. Albert Niemann first isolated cocaine from coca leaves in 1859, and by the 1880s, doctors were treating it as a serious local anesthetic. In 1884, Austrian ophthalmologist Karl Kohler demonstrated its numbing effect during eye surgery in Vienna, which gave the drug a clean white coat before patent medicine companies gave it a shelf label. Manufacturers put cocaine hydrochloride into toothache drops, throat lozenges, wines, tonics, and nerve remedies, often with no modern safety testing behind the promise. Lloyd Manufacturing Company sold cocaine toothache drops in American drugstores, and the logic was simple: touch the aching nerve, numb the pain, ignore the cost. Coca-Cola even arrived in Atlanta in 1886 with coca leaf extract in the formula. The Pure Food and Drug Act of 1906 forced labels to admit cocaine was there, and the Harrison Narcotics Tax Act of 1914 brought it under federal control. You came in with a toothache, and the cure taught medicine a darker lesson: that relief could be addictive before anyone called it danger, and the next bottle made that bargain even easier to swallow. Number 6. Heroin cough syrup. In 1898, Bayer began selling a cough and pain medicine in Europe and the United States made from diacetylmorphine, a semi-synthetic opioid derived from morphine. C.R. Alder Wright had first synthesized it in London in 1874, but Bayer pharmacologist Heinrich Dresser helped turn it into a modern medical product with a confident new brand identity. You could find it in tablets, powders, elixirs, and cough preparations, advertised for coughs, bronchitis, tuberculosis-related breathing symptoms, and pain. The promise was precise and dangerous, a morphine alternative that might calm the body without the same habit-forming risk doctors already feared. By the early 1900s, that claim was collapsing, as physicians and public health officials reported dependence and abuse. The United States Harrison Narcotics Tax Act brought opiates under federal control in 1914, and Congress banned heroin manufacture and sale in 1924. You came in trying to quiet your lungs, and medicine handed you a dependency with a label. Next, the bottle gets older, quieter, and even more poisonous. Number 5. Arsenic tonics, Fowler's solution. In London in 1786, English physician Thomas Fowler published reports on a medicinal arsenic liquid for agues, remitting fevers, and periodic headaches. The preparation became a standard prescription in Britain, Europe, and the United States through the 19th century, offered for malaria-like fevers, psoriasis, asthma, chorea, and plain old debility, a word broad enough to cover nearly anything you could complain about. The official liquid, also called liquor potassium arsenitis, contained 1% arsenic trioxide by weight, dissolved with potassium carbonate, and softened with compound tincture of lavender. The active compound was potassium arsenite, and the grim catch was that arsenic really can affect parasites and rapidly dividing cells, so some skin and blood conditions appeared to improve. That kept the bottle respectable, but the margin was thin. Chronic use could bring abdominal pain, vomiting, nerve damage, skin darkening, keratoses, liver injury, and cancers of the skin, lung, and bladder. It stayed in pharmacopoeias into the 20th century before safer drugs pushed it aside. You were not sipping strength, you were negotiating with a poison, and the next cure brings an even heavier metal to the nursery shelf. Number 4. Mercury cures, calomel and teething powders. In 18th and 19th century Europe and America, doctors treated almost anything with mercury compounds, and the workhorse was calomel, mercurous chloride, with the formula Hg2Cl2. You might receive it for constipation, fever, cholera, syphilis, or whatever complaint needed a dramatic purge. In Philadelphia in 1793, Benjamin Rush used his heroic medicine during the yellow fever epidemic, combining heavy bleeding with large doses of calomel and jalap, while about 5,000 people, roughly 10% of the city, did not survive the outbreak. The same metal moved from clinics into nurseries, where teething powders and soothing syrups in Britain and the United States sometimes carried calomel for infant pain and bowel trouble. Mercury poisoning could bring excessive salivation, inflamed gums, tooth loss, tremor, mental changes, and kidney damage. Pink disease in children was later linked to mercury exposure from products including teething powders. Britain restricted mercury medicines under the Pharmacy and Poisons Act of 1933 and tightened safety law again in 1968. Calomel faded slowly, which is the warning. Medicine had not finished mistaking suffering for progress. Number 3. Bloodletting. For more than 2,000 years, physicians in Europe, the Middle East, and later North America treated illness by taking blood out of you. The logic came from the ancient Greek theory of the four humors, tied to Hippocrates and systematized by Galen of Pergamon in the 2nd century CE, where health meant balancing blood, phlegm, yellow bile, and black bile. If you had a fever, headache, inflammation, childbirth complications, or almost anything else, the answer could be venesection, cupping, scarification, or medicinal leeches. The confidence lasted because the theory explained everything, even when patients did not improve. In December 1799, George Washington fell ill at Mount Vernon, Virginia, and his doctors removed about 80 ounces of blood, roughly 2.4 liters, within hours before he passed away on December 14th. In the 1830s, French physician Pierre Louis used statistics to challenge routine bloodletting, and the old certainty finally began to crack. Leeches still have a narrow role in reconstructive surgery today, but the ancient cure lost its empire. Next, medicine would stop draining life out of you and start selling it back in a bottle. Number 2. Radium tonics, Radithor. In the United States of the 1920s, this was sold as a patent medicine from Bailey Radium Laboratories in East Orange, New Jersey, with a label promising certified radioactive water. William J.A. Bailey marketed tiny bottles of distilled water containing radium isotopes, advertised as radium-226 and radium-228 for fatigue, impotence, and assorted ailments. The danger was not a bad dose. The danger was the active ingredient doing exactly what physics said it would do inside you. Eben McBurney Byers, a wealthy Pittsburgh industrialist and former United States amateur golf champion, started taking it after an arm injury in 1927 and reportedly drank about 1,400 bottles over the next few years. He developed severe radiation poisoning, including jaw necrosis, and passed away in New York on March 31, 1932, at age 51. The Federal Trade Commission investigation turned his case into a national warning and helped push stronger medical claim regulation before the 1938 Federal Food, Drug, and Cosmetic Act. The bottle promised energy, it delivered a slow internal exposure, and the next cure would aim directly at the mind. Number 1. The lobotomy. This was brain surgery sold as psychiatric rescue, first pushed into modern medicine in Lisbon in 1935. Portuguese neurologist Antonio Egas Moniz introduced the leucotomy after hearing that cutting frontal lobe connections changed behavior in chimpanzees, then worked with surgeon Almeida Lima to drill into patients' skulls and destroy white matter pathways in the frontal lobes. In September 1936, Walter Freeman and James Watts performed the first United States prefrontal lobotomy at George Washington University Hospital. Freeman later made it faster in 1946 with the transorbital method, using an ice pick-like instrument through the eye socket, and he traveled hospital to hospital demonstrating it. You might arrive with schizophrenia, severe depression, anxiety, obsessive symptoms, or institutional agitation, and leave quieter because parts of your personality had been cut off from the rest. Moniz shared the 1949 Nobel Prize for leucotomy. Freeman performed or supervised roughly 3,500 procedures, while 40,000 to 50,000 happened in the United States. Rosemary Kennedy underwent one at age 23 in 1941 and was left severely disabled. Chlorpromazine entered United States psychiatric practice in 1954, and the miracle cure rapidly became evidence of how far desperation can be mistaken for treatment.